Well, good morning, everyone, and welcome. We're so glad to have all of you here today. Today, we're going to be talking about the medical assistant program and what a medical assistant does. And students who are participating, we're so glad you're here. My name is Kathy. I'm a career advisor at Flathead Valley Community College. And if you have questions today, you can enter those in the Q&A section, usually at the bottom of your screen, and I'll go through and ask those questions of the participants. We'll also be asking them questions that we already have written down. And let's begin with you, Chris Degenhart, for introductions. If you could take just about 30 seconds to share who you are.
Okay, I'm Chris Degenhart. I'm the program director here. I've been teaching at the college for about 17 years, and I worked as a medical assistant for 30 years. So I'm anxious to answer questions.
Terrific. Nicole, can you tell us a little bit about you?
My name is Nicole Wheeler. I'm the clinical lead of certified medical assistant at Big Sky Family Medicine. I've been a CMA for the last 6 years, and I've been in healthcare now going on my 11th year.
Okay, terrific. Thank you. And Kelly, can you tell us a little bit about you?
My name is Kelly Weiss. I am a current student at the medical assistant program with Chris, and I've been a CNA, a certified nursing assistant, for the last 2.5 years. I was kind of staying in healthcare, but switching tracks, I guess.
Okay. So people can sometimes start as a medical assistant, and it sounds like they can also come to it from other things.
Absolutely.
Got it. And I guess I should ask, students, can you hear us? Can somebody put a question into the Q&A so I can know that you can hear us? Yay. Okay. Thank you. I appreciate that. Okay. Well, let's get started then. Nicole, if you don't mind starting with, what were your thoughts in high school? Was this always what you knew you wanted to do?
Not medical assisting. I always knew I wanted to be a nurse. That was where I had wanted to be since I was a little kid. And so when I was in high school, my first point was to become a certified nursing assistant. I thought that was a good groundwork to get. So I started there. After high school, I did go to MSU Bozeman to get my nursing. I didn't have the right structure I needed for schooling and stuff, and just didn't do as well as I should have. And so then I came back home. I did the nursing program again here at FVCC and didn't get in my first year. So I was like, all right, I've done 2 years of school now. I kind of need to look at maybe something different just to still stay, in the medical field. And that's how I found medical assisting. I didn't even know about it prior until I went looking for it. And it's been a great option.
Okay. Well, and so with that being said, what do you like most about this?
About medical assisting?
Yeah.
I love it in terms of, I love the collaborative role that I have with the doctors and providers that I get to work with. It really brings to, you're really a part of a care team model of providing care. And I like that, above from the CNA and stuff, just a little bit more hands-on that I get to have with patients and the procedures. I really thrive on being able to do procedures, and I get to do that and help them with injections and giving medications and all of that. So it's a really hands-on job, which I love.
Okay. And probably ever changing.
Correct. No 2 days are the same, which is awesome.
Okay. Well, and Chris, maybe we could back up a little bit. Can you share sort of what a definition of what a medical assistant is?
Well, the difference between the nursing program and CNAs, they're trained in more bedside care, and a medical assistant is trained in ambulatory care, meaning the medical office where patients come in for their appointment and then leave. So they're the only profession that's specifically trained to work in the medical office right alongside the providers.
Okay.
You become their right-hand person.
So, and have you seen the profession change through the years?
Yes, and that's what's nice about it, is it's constantly changing. So if you love to learn and that's a quality you want to have, is the continuing learning. And medicine is changing all the time. It's exciting. And so I just encourage it. It's a very rewarding career.
So you really get to work with people. You get to
Oh, yes.
that experience.
So in that, you need to have really very good people skills. and communication skills, and just the warmth and caring that your patients can feel from you.
Okay, well, thank you. And Kelly, as a current student, what are you most excited about with this profession?
Being able to get into an office and, like she was saying, work directly with the patients. Because as a nursing assistant, it is more bedside care, more activities of daily living. But I also would like to be more involved with the procedures and the hands-on with assisting people on a daily basis and seeing more variety of diagnoses and being able to help a wider variety of people.
Okay.
Yeah.
Well, and Nicole, I'm curious, do you have something like a typical day? Does that exist?
Not quite. In my role that I'm in as the lead, it just kind of varies depending on the clinic needs. I fill in any provider schedule or our walk-in clinic. So working with the doctors directly if needed. And so on those days and stuff, you're rooming patients, giving medications, administering vaccines. You're working on the telephone loads throughout the day and stuff, for patients that aren't in the clinic but are calling in, helping with that as well. And then if not on the floor, actually helping and stuff, I take care of all the other clinical stuff. So my day varies quite a bit and stuff, but so does everybody's. I mean, even if you're with the same provider every day, you have no idea what your patient load's going to be like for the day.
And so from office to office and from day to day, this can be very different.
Yeah, especially office to office. So our clinic at Big Sky Family Medicine, we're a primary care clinic. So we serve a very diverse patient population. We get from newborns, well childs, all the way to, very geriatric patients and stuff. So you get a good scope of it versus, at other like specialty clinics where maybe you're only dealing with adults or only adults after surgery or, whatever the circumstance that brings them in. So that's one part I really love about primary care is that you really get to see it all and, deal with all types of patients.
Okay, well, now I'm going to make it more challenging. I'm curious for each of you, what has been like one of the coolest moments for you in this field or in this training so far? And maybe we could start with you, Chris.
Well, I was in family practice for 15 years here in the Valley, and then went into other specialty practices here in the Valley. So what has been fun for me is I run into people. Actually, there's a professor here at the college that I gave his baby shots to. Mm-hmm. And so it's just been fun to follow the families and the growth. And so that's been rewarding for me. I like that.
You get to watch your community.
Yes.
Yep. Mm-hmm. How about you, Kelly?
Like I said, I'm still just a nursing assistant. I haven't worked in the medical assisting field in a doctor's office, so my experience there is pretty limited.
Yeah.
The program at the college is great, but I can't say it's exciting yet because we haven't really been out in the field yet. It's just still, it's school, but it's fun school. But as far as healthcare goes, I'd say the coolest, maybe most rewarding thing I've done is I was there to give somebody the Heimlich before, and you feels pretty good when you get a chance to save somebody's life like that on the spot. And you get to see some really interesting stuff if you have a stomach for it. You see some very, kind of stuff that you're not going to see at other jobs, medical conditions and, things that aren't normal. I once found a roundworm in somebody's catheter line, which should have been in their, in the digestive tract, but he had enough connection between his tracts that a roundworm made it through into his bladder out of his catheter. So it was very interesting and kind of, gross to some people, but fascinating to me what you can find and see in the field.
Well, kind of like Nicole said, like every day is a new adventure. You don't always know what to expect. And is the CMA often the first person, if I were to go into an office, that I would talk to once I'm brought back, or?
Yeah, the CMA are the people that would check you in, or not check you in, but they're the ones that room you, and they come back and they take your weight and your vitals, and they, listen to you, tell them why you've come in today, and it's like Chris was saying, they're the right hand person for the provider to.
So always moving, always something to do.
Yeah.
Okay, that's a fair assessment then. Okay, let's move on to something else. How about Chris, you mentioned a little bit about needing good customer service skills, good people skills.
Mhm.
What would you think would make, what would be characteristics of an ideal professional or an ideal student for this field along with that?
Well, you want to possess a high level of integrity and honesty. You're working in a profession that needs a lot of confidentiality. So you want to be that type of person. Professionalism, and within professionalism means dependability, and integrity, just exuberating warmth, comfort to the patients. So that's, and a good attitude, because as Nicole was saying, your day can flip on a minute.
Mhm.
And with unexpected things happening, maybe the doctor needs to leave for an emergency. Maybe you have emergencies walk into the office. So you need to have a good attitude and a good team approach to your work. And because there's a lot of people that work in the office, and if you all work together, that's how it works the best, and just back up each other.
So it sounds like you have to be adaptable, flexible, be able to think on your feet because stuff is changing.
And good critical thinking skills. Yeah.
That's what I was going to add in, is probably one of the biggest ones in my opinion, and that I look for is the critical thinking skills in medicine. In some regards, there is a lot of black and white, or at least we try to make it black and white, but there's a ton of gray, and you have to have that critical thinking to go, okay, this isn't what the book told me, but something's off here, and think on that and stuff. So that's a huge skill.
Yeah.
Okay. Well, I appreciate your sharing that. I know that my own experiences, as you walk in and the CMA and the different things I brought my family in for, I can only imagine all the things you see in a given day.
Mm-hmm.
So with that being said, how do you prepare yourself for that? How do you prepare yourself to face things that you won't know what they are? Nicole, do you have a thought? I see you.
So like with our clinic and stuff where we have the primary care, on that side of the clinic, you have the advantage of, what your schedule is. So being prepared each day, showing up ahead of your schedule and going through and okay, this is what they're here for. This is what I'm going to need for that appointment. That helps you prepare. And, you're looking through the charts and stuff, gathering any kind of information, what's their history? Did they just have labs done? Who they just have an appointment with? Any of that kind of problem gathering information that you can get, that helps you. In the walk-in clinic, you don't know what's coming through your door. So again, just having that adaptability and open mind and just ready, to face whatever comes through.
Mm-hmm. To have that curiosity, kind of like Kelly was talking about, and that interest to take it in. So Kelly, what do you feel like overall is one of the most challenging things about this program and this training?
I think one of the hardest things, kind of getting into healthcare in general, and even the MA, is learning medical terminology and the pharmacology, like the spelling and the names of drugs that you'll come across and be documenting on a regular basis. It's almost like learning another language. So it takes a little bit of practice and getting used to, but other than that, it's just a lot of, it's thirst for knowledge and desire to learn and help people.
Okay. That sounds good. And I think that patients appreciate that person who has some empathy and is the kind person that's asking them about what they're feeling vulnerable about. So what would you tell a student interested in this to do now, between now and when they could apply for schooling? And Chris, what would you start with? And then Nicole, it looks like you have something to say too.
Go ahead, Nicole, and I'll.
Oh, okay. I would say start with your CNA. If you're still in high school, that is the best foundation you can have. A lot of the best nurses and medical assistants started from the bottom as a CNA. It gives you a really good foundation into, what even is healthcare about. You build some really good foundational skills that are important to have. And it's just a great foot in the door, and you can take your career anywhere from that starting point. And then it's also just a good safety net to have in your back pocket, should, something else fall through down the line. If you always have your CNA to fall on, you've got a good job that pays well, that is something to do. That's great. So that's my first starting point if you're still in high school, is to definitely get your CNA.
Mhm. Sounds like a good tip. Thank you. And Chris, do you have something to add to that?
Well, the only thing, at the high school, you have the Running Start program. And so you can take the medical terminology ahead of time, I believe, through that Running Start. That's a good introduction to medicine, terminology, you know, the terms that are used and why the language is set up as it is, and to understand it. And with that, you learn a lot of medicine, just learning the the language. So I would say start with that. And as Nicole said, that we have a great CNA program here, and you work in the field there, you get a
You're going to have a job. It is huge demand for it. So
there you go. For both the CNA, yes. And then after you finish the program here, the job opportunity in the Valley, well, anywhere in the US, is high. They're very there's a high demand for medical assistants.
So where would someone potentially work then?
Well, they could work at, like Nicole works at a family practice or a multi-practice where they walk in and they have scheduled appointments of all ages. You could be in pediatrics, so specialty clinics, oncology, and you could work in urology, gastroenterology, just all of the different specialties. And that's a lot what medicine has gone to now, are besides family care, then all the separate specialties. And there are many in the Valley. And so if you have an interest in one type of medicine, then that works great. You can get into that and really learn quite a bit. A lot of people that get into a specialty group, then sometimes their providers will send them to extra training so that they're specialized in that specific specialty.
Okay, terrific. So is there, would you say there's room to grow then in the medical assisting field?
What would you say, Nicole?
Yes, I would. Again, like you said, there's a ton of different certifications and specialty trainings that you can obtain from it. And then even if medical assisting isn't, you know, your long-term goal and stuff, again, it's a great foundation to have if you're going to go on to nursing or physician assistant, anything else you want to do in healthcare.
Okay. Well, and I guess I want to backtrack then, thinking about some of this. And like Kelly, as you're heading into this as a student, is that part of what is appealing? Is that you can be in so many different offices or situations, or what?
Yeah, absolutely. Yeah, I love the like the potential for, you know, I guess, variety in places you can work. And like Nicole was saying, it's a great base for anything you want to get into, because even if the classes that you're taking now don't directly apply to, say, the nursing program, the knowledge and experience that you're going to get doing it will take you, you know, further in any direction you want to go. So yeah, it's the option to work in so many different specialty offices or just a general practice office. You know, it's a good schedule that you wind up with. You know, if you need to work a Monday through Friday kind of schedule, it's easier to get than if you're in nursing, because you will work a lot of holidays and weekends in the nursing programs and nursing jobs versus the MA. So it's kind of fits a lot of different nooks and crannies that the nursing program doesn't hit.
Okay. Well, and I guess I'm curious, you've already shared a little bit about that then. So do you have advice as a student for someone considering this career?
Well, like Nicole was saying, I think the CNA is a good place to start. It's a shorter program, and it gives you a lot of just very base skills, and you learn a lot just being on the job there. You make good connections and like talking and working with other medical professionals. But I would say don't hesitate to get straight to the medical assistant program if you have the time and you know that's what you want to do right away. You know, I wouldn't hesitate to go into it.
Okay, well, thank you. It's nice to hear all the different perspectives that you have. Well, and I'm curious, and Nicole, you might be a good person to start with this. What kinds of decisions specifically would you find yourself making in any given workday?
Tons of decisions.
Yeah.
constantly, again, kind of goes in with your critical thinking and stuff. If I'm getting vitals and stuff, I'm verifying, are they normal? Is there any abnormalities with it? If there is, making sure I'm alerting my provider right away or following up on it. Other decisions and stuff, you're having to do like med reconciliation. So going through there, all right, what's important? What does the doctor need to know about this visit to, of what medications are on? Are they on an antibiotic that they're really going to want to know about? Those kind of stuff. Throughout the day and stuff, as we're working on workloads and refilling medications, you've got decisions there. Is it meds that they should be on? Is their dosing correct? Does this require a follow-up with the provider? Anything like that. So pretty much every action you're doing, you've got to be putting your thought process into and using your skills and knowledge to make sure you're doing what's best and safest for the patient and not making any errors. And it's a huge weight of responsibility too, because that's one part with the medical assistant is that you're on your provider's license. So if I mess up, my doctor's at fault for that. And that's a huge weight. And so I take that very serious in, how I'm processing my stuff, of making sure I'm doing things correctly and what's best for the patient.
So I can really see where you could build on your foundation of knowledge from place to place and from year to year, and that you want to do that.
Correct.
Okay. Well, we've got about 3 more minutes. So to kind of finish up here, I'd be curious, what would you recommend for someone looking for a training program to be a medical assistant? What sorts of things should they look for wherever they choose to go? Chris, do you want to speak to that?
I would say definitely my program, but because I say that is that we are credentialed, accredited with the national organization. It's called CAHEB, that accredits medical education colleges. And then with going through this program, you are capable of or eligible to take the national exam to become a certified medical assistant with the American Association of Medical Assistants. And in order to sit for that certification exam, you have to have gone to an accredited college program.
Okay.
There are many programs available. There are online programs, there's shorter programs, there's all different kinds out there, but you need to be careful and watch who they're accredited with, because when they say accredited, there's a lot of different kinds of accreditation. And because we're accredited, I have to hold up certain standards of education, and I have to be sure that my students are taught and that they are proficient in each skill that I teach them. There's a level that I have to teach at. So this is very critical when you're looking for a program.
Okay.
And that's
well,
a huge thing too, with just our organization is shifting towards putting the emphasis and gold standard on the CMA designation. And so they're shifting away from doing like on the job training or kind of other certifications and stuff. And so paying attention to those that are accredited and going to get you your right certifications for what your workforce is wanting to hire is important.
Okay.
Good point.
Well, I think that's good advice. Thank you for sharing. And I'm curious, do any of the students out there have questions? If so, you can put it in the Q&A right now, and we'll take the next couple of minutes to answer those. And if not, we will close things out. We'll see if anyone's busily typing.
And I also welcome questions on if my email is on our website under the program, and you're welcome to email me or call me. I will meet with you or just talk about on the phone or email you back. That I'm always available for that.
Sounds good. Well, Chris and Nicole and Kelly, thank you so much for sharing your time today. And students, we appreciate your joining us as well. And if you have questions, please feel free to be in touch. And with that,
It looks like we do have one question.
One question.
yeah, good eye, good eye. How long is the program to become a medical assistant? Good question.
Good question. It's a one-year program, and you start in the fall. You apply summer semester. You start in the fall, then you go fall, spring, and summer. And then you are finished the end of the third semester, summer semester. During the summer is when you get to go work in the medical offices. It's called your externship. And I like to hear where you're interested in going, and I set you up with clinics. And that's where you put your skills to work. And you go work beside people like Nicole, and not by yourself, but she will help you and watch you and teach you. And you do that for 180 hours before you graduate, so that you are have been able to test those skills that you've learned.
So they get work in the field before they officially graduate. And okay, terrific. Okay. Any other questions? Well, we're getting close to time. So thank you, everyone, panelists and students, and you have a wonderful rest of your day.
Thank you.
Thank you.
Thank you.
Bye.